Most people ignore their gut, but your digestive system is one of the most reliable early warning systems your body has. And when it starts sending signals, you need to know which ones to take seriously. I'm Dr. Francis Horenstein, a gastroenterologist at DigestWell Health here in Columbus, Ohio. Today, we're covering the GI symptoms that are easy to brush off, but shouldn't be. We'll talk about warning signs, a simple way to track what your gut is telling you, and exactly when it's time to see a specialist. Here's what we'll cover: 1. Common GI warning signs people ignore. 2. How to track symptoms like a pro. 3. Common diagnosis behind these symptoms. And 4. When to call a gastroenterologist. Now let's get into it. Let's start with the symptoms people dismiss most often and why that can be a mistake. Warning sign number 1 is persistent bloating or gas. Feeling bloated after a big meal? Totally normal. But if you're bloated most days of the week, especially if it comes with pain, distension, or changes in your bowel habits, that's your gut asking for attention. This can signal anything from small intestinal bacterial overgrowth to IBS to celiac disease. Warning sign number 2 is rectal bleeding or blood in the stool. This one is never okay to ignore. Blood in the toilet, on the toilet paper, or mixed into stool is not something to wait on. It could be hemorrhoids, which is very common, but can also point to colorectal polyps or cancer, inflammatory bowel disease, or diverticular disease. Get it checked every time. Warning sign number 3 is unintended weight loss. If you're losing weight without trying, 5 or more pounds over a few weeks, and you haven't changed your diet or activity level, that's a red flag. The GI tract plays a central role in nutrient absorption. Unexplained weight loss can indicate malabsorption issues, inflammatory conditions, or in some cases, GI malignancy. Warning sign number 4 is chronic heartburn or difficulty swallowing. Heartburn once in a while, probably fine. But if you're reaching for antacids more than twice a week, or if food is getting stuck when you swallow, that's when we need to take a deeper look. Chronic GERD can progress to Barrett's esophagus, a precancerous condition. Difficulty swallowing or dysphagia needs prompt evaluation. Warning sign number 5 is changes in bowel habits lasting more than 2 weeks. We're talking about a shift in frequency, consistency, or urgency that sticks around. Constipation that won't quit, or diarrhea for more than 2 weeks, or alternating between these two. These patterns can indicate IBS, IBD or inflammatory bowel disease, microscopic colitis, or in adults 45 and over, can be early colorectal cancer changes. Warning sign number 6 is abdominal pain that keeps coming back. Occasional stomach pain is normal, but recurring pain, especially pain that wakes you up at night, pain that's localized to one spot, or pain that comes with fever or vomiting, this is a different story. These symptoms can indicate peptic ulcer disease, pancreatitis, gallbladder disease, or in acute cases can be appendicitis. One of the most powerful things you can do before seeing a gastroenterologist or any doctor in particular is to track your symptoms. It sounds simple, but it genuinely changes what we're able to diagnose and how quickly. Here's what I tell every patient. 1. You need to track what you eat and when. Food triggers are real, and patterns take days or weeks to see. Number 2, when your symptoms actually occur. Is it right after eating, or does it occur hours later? Is it in the morning, or towards your biggest meal or your last meal at night? Number 3, your bowel habits. What's the frequency? What's the consistency? And you can use the Bristol stool chart for that. Any blood or mucus. The fourth are, what are the associated symptoms? Is there fatigue involved, skin changes, joint pain, or fever? GI conditions often show up outside the gut first. There are tools that you can use. You can use a simple notes app on your phone, a paper calendar or a pocket journal, Whatever you'll actually stick with is just fine. There are also apps called My Symptoms or GI Monitor that are designed specifically for this. Even 2 weeks of consistent tracking gives us dramatically more information to work with. Okay, so when exactly should you stop Googling and pick up the phone? Here are the clear signals that it's time to see a gastroenterologist, not just your primary care doctor, but a gastroenterologist specifically. So, see a GI specialist if first you have rectal bleeding or blood in your stool, any amount or at any point in time. The second, you've lost weight without trying. The third, heartburn that isn't controlled with over the counter medication or you have difficulty swallowing. The fourth, bowel habits that have changed or stayed changed for 2 or more weeks. Fifth, you're 45 or older and haven't had a colonoscopy. Six, you have family history of colorectal cancer, inflammatory bowel disease, or advanced polyps. Seventh, you've been told you have elevated liver enzymes or fatty liver on imaging. Eighth, abdominal pain is recurring, waking you up at night, or accompanied by bloating or nausea and vomiting. I want to say this clearly. Seeing a gastroenterologist is not something to fear. Our job is to give you answers and peace of mind. Most of the time, what we find is very manageable. And when we do find something serious, early detection changes everything. Don't wait until symptoms are unbearable. Your gut is worth listening to. If any of what I described today sounds familiar, or if you have a loved one dealing with these kinds of symptoms, I want you to know that DigestWell Health is here for you. We're a gastroenterology practice based right here in Columbus, Ohio. We specialize in everything from colonoscopies and management of acid reflux to liver disease and management of inflammatory bowel disease. We see patients at every stage, whether you're coming in for a routine screening or you've been struggling with symptoms for years. Scheduling is easy. You can call our office or request an appointment directly on our website. The link is right below this video. Most insurance plans are accepted, and our team will help make the process as smooth as possible for you. If you're not sure whether your symptoms are worth a visit, call us anyway. We would much rather answer a question and tell you everything looks fine than have you wait too long on something that needed attention.